Well, more than 2,000 children infected with COVID-19 today. Welcome into News 2 at 4. I'm Alex Dennis.
And I'm Erica Francis. We are tracking new COVID-19 data in Tennessee, and this is not good news. More than 2,100 infections were reported today alone. Children ages 5 to 18. That's the most ever for the age group. Meanwhile, this graph shows the number of statewide COVID hospitalizations. If you look carefully at the blue line there, it shows just how many people are currently on ventilators. As of yesterday, that number is now up to 474. That is a record high.
And despite COVID-19 rates dropping as vaccines have become readily available, we are heading in the opposite direction. That's the message from 10 of the area's major hospital systems as they are now begging Tennesseans to get vaccinated. In a letter signed by the CEOs of those hospitals, they describe the unnecessary suffering they've seen and the regret from some patients on ventilators who wished they had gotten the vaccine. Doctors now warning the forecast for the next 2 weeks is grim. State Capitol Newsroom reporter Gerald Harris is live at Vanderbilt Medical Center with what hospitals are expecting. Gerald.
Yeah, 7% of ICU beds are available in the state, and now one Vanderbilt doctor is warning of what the next couple of weeks could look like. For some, the new COVID-19 surge is not a concern.
But we can't stay locked down forever. I mean, something's got to happen. The vaccines aren't really working. It doesn't look like me. We just got to keep going.
But others say we are not out of the woods yet.
We've still got a little ways to go. As long as more people get vaccinated, people pay attention to the symptoms and they just, continue to social distance, wear masks indoors when possible, I think we'll be okay.
I'm not looking forward to the next 1 to 2 weeks of COVID-19 in Tennessee.
But top doctors are forecasting grim days ahead as the Delta variant spreads and vaccination rates hover around 40% in the volunteer state.
I really hope that everyone understands that this is a pandemic that is certainly flaring up right now, and there are things that we can all do to not only protect ourselves, but to protect members of our family, of our household, and of our community.
Tennessee is reporting a 7-day average of more than 4,500 cases. On Wednesday, the state reported more than 6,500 COVID-19 cases, the highest amount since January 16th.
Certainly the trajectory is heading upwards. We have not plateaued, and it's hard to know how high these numbers can get. We certainly hit a peak in late December, early January, and our concern is that we're going to surpass that peak if we continue at the rate that we're seeing right now.
And a large part of the worry for doctors not only at Vanderbilt but across the country is children becoming increasingly infected with COVID-19.
The reality is that more children are getting infected on a daily basis, and the more kids who get infected, the more likely it is that we will see children who become severely ill and end up having to come to the hospital for care.
And doctors say to prevent a trip to the emergency room, you can take some simple steps. One, beginning with vaccinations. Another is wear a mask indoors if you're unable to socially distance yourself. And lastly, if you're sick, stay at home. Reporting in Nashville, Gerald Harris, News 2.
Meanwhile,